Dear colleagues, I'm Christoph Diener from the medical faculty of the University Duisburg-Essen in Germany. And today I want to report the 10 most important publications and studies which were published in 2023. Number one, monoclonal antibodies against beta amyloid for the treatment of early Alzheimer's disease. For two monoclonal antibodies, lecanemab and donanemab, there was efficacy in slowing the disease progression. But in practical terms, these two treatments pose significant practical problems. Number one, for diagnosis, you need PET-CT. The therapy has to be done IV in regular every 2 weeks or every 4 weeks. And there are a number of side effects which need MRI control, and the treatment is very expensive. And we have at present no infrastructure for treating these patients. And we also have a number of monoclonal antibodies which were not effective. Number two, amyotrophic lateral sclerosis. There is a small subgroup, 1 to 2% of patients who have mutations in the SOD1 gene. And there is now a new antisense oligonucleotide called tolfersen. And tolfersen reduces the concentration of SOD1 in the cerebrospinal fluid. And there is a clinical phase 2 trial ongoing for efficacy. Number three, modern anti-epileptic drugs taken during pregnancy in females with epilepsy. And there is a study which showed that modern anti-epileptic drugs like lamotrigine and levetiracetam have no effect on cognitive function in children aged 3 years. But remember, valproic acid and topiramate are clearly contraindicated in females with epilepsy during pregnancy. Number four, there is an interesting disease which is called radiologically isolated syndrome. And these are patients who get an MRI for whatever reason, and they have signs of multiple sclerosis. And we have now 2 studies, placebo-controlled, for methyl fumarate and teriflunomide, which showed that you can delay the onset of the first episode of the disease compared to placebo. The 5th study is a study in low-grade gliomas. There is a dual inhibitor of the mutated enzymes IDH1 and IDH2, and this is called voradisenib. And this drug clearly improved the prognosis of patients with low-grade gliomas at first time that there is an effective treatment. Number 6 is the issue of triptan non-responders in acute migraine attacks. The companies which produce the G-pens and lasmiditan claim that up to 30 or 40% of patients are non-responders to triptans. But a study from the German migraine registry showed that true triptan non-responders are not existing if patients are given the opportunity to try 3 different triptans. Number 7, we have now these very effective monoclonal antibodies against CGRP for the prevention of migraine, but 30% of patients will not respond. And there is hope, because there is another molecule which is involved in migraine, which is called PACAP. And at the International Headache Congress, there was a placebo-controlled study which showed that a monoclonal antibody against PACAP is superior to placebo. And we hope that this might be effective in people who do not respond to monoclonal antibodies against CGRP. Number 8, acute back pain and neck pain. A large study from Australia clearly showed that opioids are not superior to placebo, and they should not be used also to avoid addiction. Number 9, thrombectomy for large ischemic strokes. We were afraid to treat these patients out of fear of an increased risk of intracerebral hemorrhage. But this is not the case. There is a tension study with 253 patients, which clearly shows that thrombectomy is superior to standard of care. And we have now 3 studies that showed that thrombectomy is also effective for large ischemic strokes and has only a small increase in intracerebral hemorrhage. And finally, in 2022, there was a large study published from China, which showed that remote ischemic conditioning in acute stroke might be effective. And this is done by ischemia in the upper extremities, intermittent ischemia. And now there is a new study in Europe with 1,500 patients which showed no benefit of remote ischemic conditioning, even if the treatment was started on the way to the hospital. So dear colleagues, 10 important publications and studies from 2023, which have impact for the treatment of our patients in neurology. I'm Christoph Diener from the medical faculty of the University Duisburg-Essen. Thank you very much for listening and watching.